So this question is in reference to why the CDC does not recommend testing for herpes and why herpes tests are not included on a standard STI panel. So this is proof that the CDC does not recommend testing for herpes unless you have signs or symptoms, and the problem with that is that around 65 to 90% of people who have herpes are asymptomatic, meaning they show no signs or symptoms. And you can also pass it while being asymptomatic, so you can pass it to a partner while not having any signs or symptoms. The first reason why they do not recommend testing is the most critical side effect of getting a herpes diagnosis is depression, and people want to, unalive themselves over a skin virus that they've never shown signs or symptoms for. So it's not really worth it to diagnose people when it doesn't really do anything but make them depressed. There's also been studies done showing that people who are asymptomatic for herpes and test positive do not change anything about their sexual behavior. They do not disclose. They do not use protection more cautiously. So all it's doing is making people depressed and still spreading it. There's also some limitations to the blood test, meaning that you can get false negatives and false positives depending on when you test. So they figure they just might as well leave it off, being it's not super accurate anyway.